As of today in Canada, the drug OxyContin is out. It's being replaced by Oxy-Neo. The new painkiller is less likely to be abused than the frequently abused OxyContin, but there may be some downside to the switch. Some people are warning of an impending health crisis in this country as addicts suffer withdrawal from OxyContin. It's a particular concern, but not exclusively, to First Nations communities. In some of those communities, it's believed the addiction rate is around 50%. To talk about this drug and the switch, I'm joined now by CBC medical specialist Dr. Karl Kabasele. First of all, let's talk about what OxyContin was good for.
Absolutely. So OxyContin is the active ingredient oxycodone, which is related to morphine. It's an effective painkiller, but the OxyContin formulation was supposed to deliver the oxycodone slowly and gradually over time, so it gave you sort of broad coverage. The problem is when you crush up the pills, you can get access to the drug oxycodone all at once, and that can cause a high, that causes the euphoria, and people who become addicted to it may be chasing that feeling. So the new pill, Oxy-Neo, is the same active ingredient, oxycodone, but it's harder for you to crush up the pills and it's harder for you to mix it with water to inject it. So all the various ways that people might abuse it, it's now more difficult to do that with Oxy-Neo.
Okay. What is I mean, how many people are on OxyContin in this country?
You know, that's one of the problems that we have. One of the shortcomings of our system is that it's very difficult to track exactly how many people are taking it, partly because we don't keep adequate records and we don't have the electronic monitoring that we should. In other words, you know, doctors' offices should have computers that are accessible by pharmacists and so on. That's something that we need to work on. But other than that, there's a concept called diversion. So where you have legitimate prescriptions of this drug, it becomes diverted to the underground economy, and people start to sell these drugs on the streets and in communities and so on.
Because they've discovered what a great high they can get from it.
And you can make money off of it.
Okay,
Yeah.
So let's assume that some of the people we've heard from are correct, that there are some communities, remote communities in particular, who have a situation where they're going to be facing withdrawal as of today. What does withdrawal from this drug look like?
Well, it's similar to heroin withdrawal, which people may be familiar with in the popular media. You're taking away a drug that someone's dependent on, and it can lead to such problems as flu-like illness, muscle pain, particularly in the abdomen. People may get high anxiety. It's a very uncomfortable and unpleasant feeling that you have to go through. Ideally, if you're going to detox off of a drug like that, it should be done under medical supervision in a facility or with somebody sort of caring for you as you're going through it. The problem in these remote communities is that if all of a sudden the supply dries up and people are forced into detoxification without any help, they are now at risk because there's a lack of services, there's a lack of detox facilities, and there's a lack of addiction medicine sort of expertise available to these communities. So this is one of the crises that could be precipitated.
What's the risk of going through the detox without support?
Well, part of it is just the physical toll that it takes on you to get the drug out of your system. But part of it is also that people may be suffering so much as they're going through it that they may be driven to the point of suicide. Or if they can get their hand in the middle of detoxifying off of it, if they can get their hands on the drug, they may be so desperate that they end up inadvertently overdosing. So these are a couple of the concerns. Now, we also are concerned that as the supplies of the drug start to go down, especially on the streets, people are going to start hoarding it. And the street price goes up, and people are already, you know, having enough trouble managing financially. But the other fear is that people will start to share the drug as there's not a lot of it left. And sharing needles is obviously a problem that can lead to the transmission of HIV, hepatitis, and a number of other infectious diseases.
This was a controlled substance. It was only by prescription from doctors.
Right.
How did it get to be such a problem on the street?
Well, you could argue that this whole problem stems from the fact that it began to be over-prescribed. So it was introduced in the 1990s, OxyContin was. Over time, it became more and more popular, more prescribed. It was aggressively marketed to doctors because the idea was, well, this is a time-release form of a very potent drug, so the chances of abuse are low. But I guess what we didn't take into account was the fact that you could circumvent that time release, and you could become high by crushing up the pills. So once that started to happen, once the formularies in the various provinces started to pay for it, we started to see, unfortunately, an increase in deaths. And I'm not talking just about Native communities, but in general, an increase in deaths of people overdosing on OxyContin.
All right, well, we'll leave it there for now. CBC medical specialist Dr. Karl Kabasele, thanks for joining me in studio and explaining this scenario today. Appreciate it.